This report warns that declines in new HIV infections and AIDS-related deaths have notably slowed, with new infections on the up, while resources are inadequate to end AIDS as a public health threat by 2030.
In it, we call the world's attention to a painful reality. Currently, we are not on track to end AIDS by 2030, and the reason is inequalities. But there is good news. By equalizing, we can end AIDS. The report highlights how inequalities aren't merely harmful to individuals. They are impeding progress against AIDS, reducing the returns on HIV investments and putting millions of people in danger.
The Dangerous Inequalities report unpacks the impacts that gender inequalities, inequalities faced by key populations, and inequalities even between children and adults have had on the AIDS response. It argues that discrimination against and stigmatization and criminalization of key populations is costing lives and preventing the world from achieving agreed targets. The report says that while HIV incidence has declined since 2010 in key regions of Africa, it found no conclusive decline among men who have sex with men. In 2021, some 800,000 children living with HIV were still not on life-saving treatment, while gender inequalities remain a key driver of the AIDS pandemic, with adolescent girls and young women in sub-Saharan Africa 3 times more likely to acquire HIV than their male counterparts.
We must equalize for women and girls to reduce their HIV risks. Gender inequalities are a key driver of the AIDS epidemic, and I'd like to underscore that particular one. It's a key driver of the AIDS epidemic. Unequal power dynamics between men and women and harmful gender norms increase the HIV vulnerability of women and girls in all their diversity, deprive them of voice and the ability to make decisions regarding their lives, reduce their ability to access services that meet their needs, and increase their risk of violence or other harms and hamper their ability to mitigate the impact of AIDS.
While key populations, for example, sex workers, men who have sex with men, transgender people, people who inject drugs, and incarcerated persons must be at the center of the HIV-AIDS response.
World AIDS Day remains as relevant today as it has always been, reminding people and governments that HIV has not gone away. In the midst of a crisis of debt, austerity, and inequality hitting developing countries, cuts in aid for global health are not strategic. Now it's not the time to step away. It is the time to step up. It is through international solidarity that we reduced inequalities and financing and made amazing gains against AIDS, including bringing more than 28 million people onto life-saving treatment. And we must complete the job.
With a key message to equalize. Equalizing access to rights, to services, resources, and the best science and medicine, seen as key to ending HIV/AIDS as we know it. Sherman Rice, please, SABC News, New York.